One question that owners have a lot when they come in for surgery is how their pet's pain is going to be controlled both during surgery and after surgery, and that's something that we take very seriously here at Southwest Veterinary Surgery Service. So pain control starts from the very beginning. We see your pet for a consult. If they have a condition that's painful, something like a cruciate ligament tear, something like that, and they need pain control until we can get them in for surgery, we give them oral medications to go home. Before surgery, our surgeons will evaluate your pet and they'll develop an individualized anesthesia and pain protocol to make sure that your pet stays comfortable based on your pet's individual needs, both in surgery and after surgery. On the day of surgery, your pet will receive injectable pain medications to help keep them nice and comfortable. We also give epidural anesthesia to all of our patients who are having surgery on their back legs, things like fracture repairs, TPLOs, orthopedic surgeries especially will get an epidural. That helps provide pain control both during surgery and as they recover in the immediate post-operative period. After surgery, we also give a medication called Nocita. That's a local injection that provides long-acting pain relief for about 3 days. So they tend to be the most uncomfortable during that time, and the Nocita really helps offset that pain. After surgery, our patients are hospitalized overnight so that we can keep an eye on them and make sure that they're staying comfortable. We have trained technicians with them every hour of the night to monitor them. If they need extra pain medications, they're on hand to give those medications. One of the other benefits of having our overnight service is that our surgeons are on call 24 hours a day, and so if there's any questions or concerns, we're always available. The vast majority of our cases are discharged the day after surgery. The doctors will do an exam that morning to make sure that they're comfortable. We'll evaluate their pain. If we feel like they need an extra night of hospitalization or an extra couple of hours to help control that discomfort, we will certainly make that recommendation. It's not very common, but it is always an option if we feel like your pet is not comfortable. As part of your pet's individualized pain protocol, we will also send home pain medications as well as medications to help keep them calm during their recovery period. And we go over all of that with every owner when your pet is discharged. We give you individualized discharge instructions that explain all of the pain medications as well as when they're due. We also have other recommendations for how to control your pet. Things like helping keep them nice and quiet. We don't want them up moving around. That can create some soreness. We also recommend cold compresses to help with pain and inflammation in the immediate post-operative period. One other benefit of Southwest Veterinary Surgical Service is that we have an on-call doctor on the weekends with a phone number, and that phone number is in your discharge paperwork. So if you have any questions or concerns about your pet's comfort over the weekend, you can call that number and speak to a doctor. One question we get asked pretty often is how to tell if your pet is in pain after surgery, which is a really good question. And it's kind of difficult, it can be difficult to evaluate in our veterinary patients. We go over at your pet's discharge how to tell if they're uncomfortable. Every surgery is different, every pet and every recovery is different, so we'll tell you what to look for to determine if your pet is in pain. And if you have any questions, you can always reach out and someone will be available 24 hours of the day.